Greatness at track number 9. Stay on the right track and let your light shine. Step by step, reach for what's true. Track number 9, your greatness is waiting for you.
Good morning, good morning, good morning. My apologies for the delay. It's 9:07. We're a little late. I'm glad you all had the patience to actually wait for us to get this thing up and running. Good morning, Miss Gwen Levi. My man Johnny Jones just texted me, say, hey, where's the link? I appreciate that. He asking me where's the link so he can tune in. My man over at Living Classrooms. Anyway, I'm gonna jump right in. And first thing I want to say is we honor this earth. We honor, hey, the trees. We honor the earth and the world that God has given us. I know, we listen to our Native American brothers and sisters, and sometimes they saying to us that we should honor this earth that God has given us because we can burn it out. We can burn that sun out. We can do all these things by what they call putting our footprint on things. The more we don't recycle, the more we drive cars that are gas cars instead of having cars that are electric vehicles, the more we do things to cause climate change. We experience so many things that we don't realize it's because of the human beings and what we're doing to the earth and to the planet. Sometimes even in the waters, in the ocean, in the sea, in places where we get our fish, we got so much mercury that we put in there. People are dumping trash and garbage in the stuff that we eventually see on our plate, our codfish, our rockfish, our crabs. So I just want to say that we are going to give homage and we're going to thank our Lord and Savior for this planet. Imagine if there was no rain and no sun. We wouldn't be able to grow food. We wouldn't even be able to survive. So we thank God for bringing down the sun and allowing the watermelon and the cucumbers and the potatoes to actually grow to feed us. That's one way we can be thankful is by honoring the planet. And Earth Day is April the 22nd. So if you want to do some things, get out. And on that day, on April the 22nd, let's appreciate the earth and do better by her. The Native Americans say, be kind to her, and she will be kind to you. We won't see record levels of snow and heat that's just unbearable. That's the planet trying to tell us we need to do better by her. But anyway, I wanted to start that off because there is a correlation between environmental health and just health, period, and the health disparities that we see in Baltimore. So many people have asthma. So many, good morning, Michelle Matt. So many people are suffering from diseases that are actually caused, like lung diseases. It's caused by the air, the atmosphere. So I wanted to bring that in so that we can see the correlation between our environment and our actual physical health and the things that we might can do to make that thing better. But today, without delay, I want to bring in an individual who I had the pleasure of working with because we do environmental justice work as well at Maryland Justice Project. We do so many things, so many things have to be done. And we're going to try to do as many of them as we can. Amen. But we have done some environmental justice work through the Center for Community Engagement, Environmental Justice and Health, ran by Dr. Sokobi. And what they do is they allow the environmental justice piece to correlate with our health and our health despairs. So our guest today serves as the assistant research scientist for the Center for Community Engagement, Environmental Justice and Health. They call it SIEGE. And the Maryland Center for Health Equity at the University of Maryland Public School of Health, College Park. For both centers, she oversees grant development, financial, and standard operating procedures. Additionally, she serves as a lead researcher with a concentration on community-based participatory research, racism, and integration, AI, ML technology with public health research. She is also the founder and principal of Geneva Strategies Group, LLC, an organization that produces public health accountability and social determinants of health policy, strategies, research, and programming methods. Prior to launching Geneva Strategies Group, Dr. Weeks, and that's Dr. Weeks, conducted a work of National Associations for the Advancement of Colored People, NAACP, where she served as the Health Policy and Research Manager for over 10 years. She has been a community and social determinant of health researcher and public health policy practitioner advocating for communities of color. With a background in health education and promotion, her passion lives in building healthy communities through addressing disproportionate conditions through education and promotion on an individual and community level, behavior change, and speaking on behalf of disadvantaged communities. As an operation guru, she loves to strategize and implement sustainable resources and programs for Black communities by partnering with grassroots organizations and training communities on how to advocate for effective policies. Man, I could go on and on and on, and I'm not going to belabor the point because this young lady has done an awful lot. Over the decades, she has resided in Baltimore, Maryland, but is a country girl at heart, originally from North Carolina. Amen. But anyway, I'm not going to keep on going on with this because I want us to meet Dr. Leaks. I want you to meet Dr. Leaks. Bring Dr. Leaks to the studio. And the reason why I am so elated that she is here because in this capitalistic society, what happens is the idea of we can determine how long a person will live according to where they at their zip codes. If you know that a person lives in San West Baltimore 21217, and you understand that the life expectancy for the people in that community is shorter than people in other communities. And that is because of environmental stuff. That is because the food is so high. You got to eat food that causes hypertension, diabetes, and there are socioeconomic things that causes certain communities not to have the same life expectancy. So I want to bring Dr. Lisa in, man. I can't even tell you. I can't even tell you how happy I am because I want people to know and understand that there are folks that do data and do numbers and that totally understand how long they expect for you and your 8-year-old child to live. And it should never be that way. Nobody should be able to sit in a research lab. Good morning, Dr. Lamb. Nobody should be able to sit in a research lab and say, oh, because they have lead in these houses over here, and because the drinking water is poor quality over there, and because the corner stores in the community charge so much money for oodles and noodles, or so much money for the food, only thing people can afford, oodles and noodles, processed food. They can't go to Whole Foods. They can't afford to go to the healthy places. And people know that. They know that, and they put policies and stuff in place just because they be like, well, if we can't get rid of them one way, we get rid of them another way. So that's one of the reasons why I wanted our sister to come on and share with us some of those things that she's discovered, some of the things that we can do, and to put our attention on, put our thinking caps on, like they used to tell in elementary school. Put your thinking cap on and figure out this thing so we can get on the right track. I love to say that. Because this about getting on the right track, amen? It's about that choo-choo train getting on the right track. Welcome to the studio, Dr. Leaks. You said a lot, and we running behind, girl, but you know I can talk, honey. Give me a microphone. It is on and popping.
Good morning. Good morning, everyone. How is everyone doing on this wonderful Saturday morning? Thank you, Monica, for having me here. I look forward to having this discussion with you all. There is so much going on right now in this country, but there's a lot happening right now, healthcare-wise, that isn't being talked about in media. And so podcasts and different media outlets like this, talking about it, getting the information out to our community is important and most effective. So people are aware, they're knowledgeable, and they have the resources to know what's happening right now with healthcare, with your health insurance, with all the many things you hear talking about that's impacting the policies that are coming out that are impacting your health everyday life. We definitely want to be able to explain to you all from a data perspective what we're seeing, because a lot of times people don't see that. I work with several organizations, as Monica's mentioned. I work with her organization and probably 100 other community organizations in Maryland, and we help these organizations collect data. And so from the grassroots area, we can see what happens. We translate that and compare that to what the national rates are looking like. And we can tell you what's actually happening in real time. We can tell you how it is impacting your day-to-day life, the air you breathe, the water you drink. How can you afford health insurance? You cannot afford health insurance. So we can track that and say, hey, this is what's happening. And this is how we need your help to go and advocate to your legislators so you guys can have a healthier community. So that's just me. That's my goal. I always work on a community level, and particularly Black communities, so everybody is aware, knowledgeable, and educated on what's happening with health. So Monica, you let me know where you want me to go from there.
Yeah, well, I guess we could really start because everybody's watching policies. We watched the Affordable Care Act, constantly trying to roll that back where every American was able to get health care. And we've seen that roll back. And we see the prices of your pharmaceuticals go up. Because at one time, I think it was the Biden administration, they had put a cap on certain medications, like the diabetes medications. You couldn't get charged a certain amount. I'm going to mention this one case of this young lady. I don't know if she ended up incarcerated or not, but it was a young lady who had, I think she had bought the EpiPen. She had bought the license for the EpiPen, and she ended up trying to charge $700 per EpiPen. The rate that she was trying to charge was so outrageous, they recognized it as being illegal. And they ended up having her in Congress asking them, why in God's name would you make one pen that people are allergic to stuff that used to be something like $1.98? It was really cheap. And all of a sudden you buy it, you get the patent for it, and you make it $700. So the price of this stuff, people are making the price of your medication go up. So let's kind of start with, I believe you mentioned the highest inflation expense hurting the family is Affordable Care Act insurance and the premiums of the health care. That's that's kind of like our topic, besides bringing it all in to let you know what the environmental impact is as well. So you mentioned that daily we are discussing the inflation costs of food, gas, and housing expenses, but the highest inflation impacting every person in the country is not being discussed. And that is those high premiums. Good morning, Sister Roxanne. The high costs, like I'm fortunate to work and be able to pay a portion of my my health care, and my medication and stuff don't cost as much. But there are some people who are actually not able to even purchase their medication. People gone weeks and months without high blood pressure medicine, diabetes medication. Tell us a little bit about that.
Yeah. And so what a lot of people don't realize is that the Affordable Care Act, exactly what it is, what it says, Affordable Care Act. It was over a 2,000-page document originally, started back all the way in 2008 to find a way to reduce healthcare costs, to reduce medication costs. And, almost over the past 18 years, we've had plenty of people in the federal government fighting back to prevent us from putting in those policies so people can afford health insurance, so people can afford premiums, so people can afford co-pays. And what a lot of people don't realize is that the whole purpose of the Affordable Care Act, we know we call it Obamacare because he's the one that coined it. We give him a lot of credit for that. But the whole and sole purpose of that is so we can make sure that people can get up every day, and if they need to go to the doctor for any given reason, they don't walk out the door with a bill that's thousands and thousands of dollars that would take them months or maybe years to pay off. One thing we're talking about inflation and the cost of living and people's quality of life, medical bills are the only bill they're allowed to go to the creditor and can cause you to have your assets repossessed. There are people in this country who have had their houses, plenty of Black families, houses repossessed because somebody fell ill, cancer, they had a chronic disease, maybe diabetes, and maybe they had to have their foot cut off and they can no longer work. There are stories across this country that we could collect millions and millions of people who have lost all their assets they built their whole life because they could not afford to pay for their health care. And I can give you guys a really good example. So my grandfather actually, he's passed away now, but my grandfather had chronic heart disease and diabetes. And during back in 2008, 2009, you guys may remember hearing the term donut hole. And donut hole is when somebody has the insurance is paid out all they're going to pay for their health for their medical prescriptions. My grandfather at one point was paying $800 a month for 30 pills for his heart medication just to make sure that he could stay alive. Okay, that is ridiculous. Now, what's happening right now is after we've had the Affordable Care Act and we've put subsidies to help people be able to pay for that, they've started taking away those subsidies. So you may have heard last year how when the government shut down, the reason why they were fighting so much in Congress was because we were trying to keep that money in place so people didn't have to choose between paying their mortgage or getting their heart disease medication, paying their mortgage or getting their cancer medication. So if you guys heard last year that they actually did not pass to renew the subsidies. We had two batches of subsidies, one that came out during COVID and one that came out originally with the Affordable Care Act. The one that came out during COVID, they decided not to refund and to put money into it. So those people who are what we call up to the 140% level of poverty, they were lost their subsidies. And which means that they had to start paying out of their pocket for their health insurance. Some people's health insurance went up all the way from $80 to $100 a month, all the way up to $400 a month. Now, if you don't have that money to budget, that means you just basically give up and you stop having your health insurance. When you don't have health insurance, you're less likely to go to the doctor. You're less likely to go seek care. So therefore, those chronic diseases and issues may have diabetes, hypertension, that goes untreated for years and years, and you only get it treated when it's very detrimental, and most of the time people run to the emergency rooms. And if anybody here has been to the emergency room, you know one visit to the emergency room runs you thousands of dollars. And again, if that bill goes unpaid, that can then affect your credit, okay? And that can affect the assets that you have. So what I do is I track in the Black community how is not people not being able to have access to affordable health care, affordable access to care. How's that impact their everyday quality life? Meaning, if you are not getting care for your diabetes, are you able to still go to work and make money? Are you still able to work, make money and feed your family? Are you able to pay your mortgage? All those things are domino effect of what I call it, because the domino effect affects Black families from being able to have a healthy quality of life and improving their everyday needs.
Yeah, I appreciate you sharing that. And one thing I want to mention is that there's a saying that health is wealth. And what I'm learning, I'm not as young as I used to be, but what I'm learning is as you get older, when you have incidents, like I had broke my collarbone, girl, I was out riding a damn Harley Davidson motorcycle. I should have stayed off that bike, but I ended up breaking my collarbone, and it stopped me from being able to go to work. I had two dogs. I could hardly walk my dogs. I lived on the seventh floor of an apartment building. I had to go up and down the steps because that daggone elevator was broken, and my life was just turned upside down. I had broken an ankle before, same thing. I wasn't able to go to work. So if you're not able to go to work and bring in no money, then you kind of, you kind of messed up. And when you don't have a whole bunch of money saved up, one incident with your health, one incident with your health could have you out on the streets homeless with no home. And that's, prayerfully, we'll get to a more preventive stage so that we can take better care of ourselves, because we have a system that if they can't kill you one way, they will try to kill you another way. Any decent human being know that this country can solve our homeless issues, our healthcare issues. One person, Elon Musk got enough money to solve all of this stuff. All of these billionaires have enough money if they pay taxes. If they pay taxes properly to be able to help this system to be able to operate. But for some reason, they seem to think that trying to keep people poor, trying to keep people unhealthy is going to help this country survive, if you will. And it's not, because the emergency rooms, when they get full, it just burdens the system. So I don't understand, and it's okay. I just keep praying why the lawmakers don't see that affordable health care is a good thing. I have my thoughts, and my thoughts is just that if you can't kill them one way, you kill them another way. So it's kind of tough. I did not know that that the medical system can actually come after you for unpaid medical bills and repossess your homes and repossess your cars and stuff like that. I didn't know that. They could come after your assets. I had no idea.
So there's a documentary. It came out years ago, and it's a documentary by Michael Moore, and it actually shows him going to families, and they talk about. He actually shows different families that lost everything. And I remember there was one particular couple on there. They had their house for 40 years. The wife got cancer. The husband had to have a bypass and his heart bypass. And so both of them were out of work for about a year. Both of them got ill, and both had to retire, and they couldn't work at all. They had so much medical expenses. They lost their house, all their savings, everything. They had to move in with their children just to be able to survive, because they were paying all their money in medical bills. And what's your point about what you were saying? It can be done. For instance, I actually research other countries. So I used to live in Costa Rica for about 6 months. In Costa Rica, everybody, no matter how much money you make, the head of the household pays 3% of their income. Everybody pays 3% into the health fund, which allows everyone to then go get health care. So that they have all their clinics are public clinics. They do have some private clinics now. So if you are in Costa Rica and you are one of those millionaires, you can choose to still go to the private clinics, but you still have to pay that 3% in for everybody else to go to those public facilities. And everybody is seeing, they put in their requests of what they need. They put in the most priority, the top priority first, patients first, and then it does go down the line. But everybody does get seen. This is not just Costa Rica. This is Canada. This is also over in Italy. We have several different countries that do universal health care. We're just not one of them, even though we spend the most of our GDP on health care. So the crazy part is we're spending more than these countries who actually have universal health care, and our health outcomes are less. So if you go look at the countries that have universal health care, they have longer life expectancies than we do in this country, but we spend more of our GDP on health care. And that doesn't correlate. Scientists, there's no way we can rationalize that other than saying we're not doing this right in this country. And so the whole original purpose of the Affordable Care Act was for us to have universal health care. And of course, the legislators turned that down. Congress turned that down. And so what we need to still advocate for is universal health care. Make everybody pay a certain percentage of their taxes into a fund. And once we have that fund, then everybody can go be seen at a public facility. Okay. We have in this country privatized healthcare. And I always say this, I heard you say, they're going to find some way to kill us. I always say it's capitalism. I don't understand, I always try as a researcher, try to understand, why do we apply capitalistic economic principles to determine who gets access to healthcare and who does not? That's not fair. Every person has a right to healthcare. Access to healthcare is one of the key factors to everything in your life, to you being able to be healthy to work, for you to be able to go and exercise, for you just to go out and just enjoy life. And it does not make sense is that we capitalize it so much and make it so expensive that people can't afford it, and therefore they can't have that quality of life they deserve. Again, other countries do not do that. Do they not put that burden on the people because they understand that health is in everything that you do? But in this country, we have not realized that that is a basic human right that we should make sure everyone is getting.
I agree with that 100%. And unfortunately, when we talk about universal health care, then they always talk about, oh, this is socialism, this is a socialist society, and all that foolishness. But like you had just mentioned, the outcomes in places where they have universal health care are far greater than the outcomes here. One of the things is probably because they're just greedy. The people who have privatized healthcare are greedy. They had a man down in Florida that they ended up bringing up on charges for fraud because he had charged the Medicaid system like 4 times the amount of what this wheelchair would cost. The wheelchair, if you went to Northwest over here in Baltimore, Northwest medical supply over Northern Parkway, you could go and get a wheelchair from over there for maybe $800. This joker was in Florida charging the Medicaid system something like $3,000 for this, for this wheelchair. So if anything, the fraud is on their part. They are charging way too much. And for the medication, they are charging way too much for this medication because it's privatized. There was a unfortunate incident that happened in New York City. I forget this guy's name, but he was so upset about the privatization of healthcare. He went and killed a man. He went and shot and killed this man. And I don't know if you guys remember, but John Q. John Q was a really good movie, and that movie was about his son. His son needed a heart transplant, and they kept telling him, well, there's nothing we can do. I know people that call their providers. God, excuse me, that's the dogs running around crazy. They are insane on this beautiful Saturday morning. All you hear is they daggone little paws. But they my dogs. I'm gonna let them run free, amen. But I know people who have tried to have procedures and they get to calling their healthcare provider talking about, well, we don't cover that. And it remind you of something that's in a fine print all the way down at the bottom. When you have a warranty for alternator, it says, well, we won't replace the alternator, but we'll replace the spring that's connected to the spindle that's connected to the other spindle. We'll replace that part. And it's sad that people got to go through this process. They need things. They need better health. And these people that have these health insurance companies are saying, well, we can't cover that. We don't cover this. We don't do that. We don't do this. And we really, I think it's a good idea to actually work to push universal health care and to take it out of these rich people's hands. These people are getting rich. And the sicker your society, the more you get rich. So they're not going to do like in Europe. If you get a Fanta orange soda, it's 3 ingredients in there, maybe 4. Oranges, sugar cane, no processed sugar cane, and maybe 1 more. And you look at the Fanta orange here, and it's got all this stuff on that stuff you can't even pronounce it. You don't even know what it means. And it's like they intentionally poison their people. America is one of the only places in the world where the Food and Drug Administration intentionally allow people to poison its citizens. They have ingredients in food that you can't even give to animals. Lead, paint chips. I mean, all kinds of stuff that's not even supposed to be consumable. But what they do is they say, well, a little percentage of it can go into this candy bar. A little percentage of it can go into this cereal because it's not a whole bunch and it won't kill them. Over time, yes, it does. Our bodies are filled with inflammation, and we got bad knees and ankles, and our joints are all swollen up because of the stuff that we are consuming. Man, I'm ready to fight these jokers. I'm telling you. That's why I like being armed with information, because we are in an age of information and misinformation. So hearing the facts from you is going to be helpful to the people that's listening and helpful to me, because if God willing, all of us are going to age. And if we have a healthcare system that believe in allowing all people to age gracefully, not just some, that believe that all people deserve the right to live as long as their creator would allow them to live without putting impediments in their way, if you will. Do you know of any bills that may have been being passed or work on, or anything in a federal government that because we already know what certain people are going to do, but what are people doing to try to fight back, to try to push back? Because I tell the viewers on track number 9, all things lead to the ballot box. We would have better health care if we had the leaders that believed in that. We would have insurance that wasn't so high if we elected leaders that believe in that. So everything leads to the ballot box. If you're not registered to vote, I don't care who you vote for. You can vote for my little dog, Day Day. Vote for somebody. Just get out there and vote. It's important. So what's being done and worked on?
So right now, we'll say we are all blessed. If everybody, most people here on this call live in Maryland. Maryland did us really a good favor. Maryland made sure that last year they passed a bill that would protect the subsidies that expired at the end of 2025. So those who lived in Maryland still have access to those subsidies. So right now we're putting money into that. We have to make sure, as you're saying, that whenever this bill, because they put a fiscal note to it, meaning they put money to it, whenever that fiscal note expires, no matter who's in that office, our governor, whoever's in our senator seats, we need to make sure they're advocating to keep those subsidies and that money there. Because right now that money is not coming federally. It doesn't look like it's going to come back federally anytime soon. So we need to make sure that we're being loud and saying we want to keep those subsidies that help people afford health insurance. We need to make sure that's in our budget, in the Maryland state budget, and it does not need to be removed for any reason at all. Okay, that's the first thing. The second thing is, I encourage everybody that's listening to this, go and pull up your this year, whatever your annual premium is that you have to pay, and pull it up for the last 5 years. See if it has increased or decreased. Also, pull up, most people don't even pay attention to this. Every time you go to the doctor, your insurance bills an explanation of benefits, and they send you a copy of it. And this tells you how much of your insurance they are billing and why they are billing your insurance. Okay. I pulled mine up because I have found several errors before where medical doctors have been billing my insurance and I didn't even get the service. Why is that important? Because if you are somebody that they're billing that you're getting more services than what you're receiving, that can impact the premium going up for your next year. So just like you go and you track your bank statement and see how much money you spend, just like you go and you track how many steps did I walk today, you have to be diligent as well. And I tell people to do it every 3 months. Pull up your explanation of benefits from your health insurance company. And if you don't want to do it on the internet, have them send them to you. You can request from your insurance company for them to send them directly to your mailbox. Pay attention to what they're charging you and see how that is increasing. Again, that impacts your premium, your copay, and your co-insurance, how much is coming out of your pocket. And we actually have to track that to also be able to show our legislators, hey, my medication last year was only costing me $1,000 for the year this year. Now it's going up to $2,000. That's because sometimes we'll see different policies that will happen in Annapolis that may impact what our health insurance companies can and cannot do. Our people don't even realize this too. One of our biggest lobbyers in Annapolis are health insurance companies. Care First, Aetna, United Healthcare. They go and advocate to say, hey, we want to be able to charge this much rates for premiums or certain prices for certain type of medications, cancer, diabetic medications, just as much as they're in Annapolis advocating for maybe a certain rate on medications and health procedures. We have to go to Annapolis and advocate and say, our communities can't afford that. Okay. So another thing is, we have in Maryland, there's this thing called the Healthcare Commission, HRSC. They're over here in Baltimore on Righteoustown Road. They meet once a month. They're the commission that regulates hospital rates, They regulate a lot of our rates, prescription rates with the hospital. They regulate all that stuff. It's an open meeting. So just like you can go to Annapolis and talk to legislators, you can go to these open meetings and talk to the different commission members who actually help the hospitals determine what rates should be charged. And you can advocate and say, hey, we can't afford that. We can't afford for you guys to keep going up on cancer treatments or diabetic medications. That is something I encourage people to do as well. And people always say, well, we have people like you, Dr. Weeks. I am one voice. I go, I advocate, I speak. But there's nothing like having a team of 15 people with me roll up in there and sit there and ask questions. And the biggest thing is best to do it. They don't expect it. They're like, oh, these people are actually paying attention to what's going on. Yes, we have to pay attention. We have to speak up, and we have to be loud about it. And one thing I'm noticing is that in Baltimore City, we have a lot of elderly who live alone. And the problem with that is we need more resources put into senior care at home, care that can come to our seniors. But right now, we're not putting a lot of money into the state when it comes to our Medicaid and Medicare system. And that needs to be another shift that needs to happen. So next session, I need some of my seniors to come with me and advocate for that so we can get money put in for health and home care services for more of our seniors.
I think that is a wonderful idea, and we have enough people that tune in. In fact, Miss Sarah Matthews, she works with within older adults in Baltimore. She is an absolute expert. I think that would be a good idea for myself, you, Miss Matthews, to kind of get together and take about 15 to 20 people, number one, to pay a visit to Ricerstown Road. It would shock the crap out of them because they never get visits, and they know that they're making policies and making moves that people have no idea about. It's like our presence would shine a light on a situation. The wickedness is always done in the dark. It's always done in the dark, away from the prying eyes, away from the public, behind closed doors, where can't nobody see them. And when you come, you shine a light on that. So I think that would be a wonderful idea for track number 9. Miss Sarah, yourself, especially come next session. My grandmother passed away last year, God rest her soul, at 95 years old. And my cousin Nancita went through so much to constantly to make sure that she had a healthcare person to come in the home. And that is one of the biggest challenges. Thank God that we are getting older. Our society, people aging and living longer. 100 years ago, if you lived to be 32, boy, you was an elder. you were old folks back then. But with modern health, with all of these things that they come up with to help, prolong a person stay on a planet. I think it was she says, when do we meet and where? Miss Sarah. And also she's helping sister with Delegate Malcolm Ruff. Hey, we got, oh man, Delegate Addison is here. And Delegate Malcolm Ruff had just spoke about yesterday about appropriations. I believe he's the chair. So he just spoke about a 1 point something budget that they just passed. He just spoke about it yesterday. So he is the man who is in charge of the money. In the 41st district, Delegate Malcolm Ruff is the man in charge of the money. And we need people, get out of there. Sorry, that's the dog. We need people that that are champions for us and for our needs, that control the dollar. So man, that's a good idea, what you mentioned and what you shared about right on Ricerstown Road. The healthcare commissioners are right there on Ricerstown Road. We definitely gonna make that happen. I'm gonna make sure I link you up with Sarah Matthews. She's a champion, and we can get 15 to 20 people there at the on Ricerstown Road. And come this next session, we can definitely get some folks to link up with you to make some things happen. Man, it's so much information that you are providing. I appreciate you, and I know that the folks in the audience appreciate you. Brother Robert Winslow said one of the problems is that the insurance company controls the doctors. It seems like these doctors get kickbacks for giving you medication that's super high when they could have gave you this, or giving you medication. My grandmother, when she went to the doctor and they gave her some, she said, let me see that pill. She would always look at the pills, and even when my cousin was, taking care of her, she looked at her medicine. She was in her right state of mind. She would always look at her medication, say, "That's not my pill. That's not the pill I take." She knew what she took because older folk know how these hospitals and institutions are. Like my grandmother's, it's certain hospitals. She never even liked going to the hospital because you might not make it out all of the testing that they've done on people. They giving you medications and experimenting on you like a guinea pig. Even in prisons, they had a prison up in Philadelphia where they knew that the inmates or the people who were there didn't have, they had limited money, so they would do all kinds of stuff that they wouldn't even do to animals to make sure that these guys had commissary money because they knew they didn't have any money. And to take advantage of populations has always been the thing in this medical field. I know that some people might, when we talk about gynecology, there was a doctor, they called him a monster. What he did to the enslaved women and what he did to experiment on them to bring us to the GYN that we have today. But what those women went through was pretty horrific. So we definitely appreciate you. And as we kind of move, because there's so much, we got to invite you back. We got to invite you back because there's so much information and so much that I know that we can do in conjunction with you, our viewers. We can link up and we can bring some power to this to these situations because the people is the power. The people engine this. The people is the engine, if you will, like track number 9. But the people are the engine for change. If you got one person there that's saying we should do this, we should do that, but when you got 100 people there, that's what makes the difference. That's what makes the difference is having the people there to be the engine of change, if you will. But share with us. Go ahead.
Yes, so for that healthcare commission, we meet the second Wednesday every month. It is at Town Plaza. It's on the side of the building where I believe that's Capital One or PNC Bank is, and there's a Wendy's there. But I also make sure I'll send out the address. But it's the Town Plaza. There's a Giant there. I think there's a Burlington there, so I think everybody knows what I'm talking about. But that's where they meet, right there.
What time? Do you know the time, or you're just sending information out?
I believe it's at 11 a.m., but I will verify that. So it's second Wednesday every month. So they actually will be meeting this Wednesday coming up, April the 8th, I believe.
Will you be there?
I should be there this week. I may be there this week.
Let's try to get some people. You get me that information, and I will try to get it out there. Put it on Facebook, and I send all these text messages to my people. Girl, I be texting the crap out of them. I know they be saying, "Monica, don't you send another text about track number 9?" Right. I can't help it. That's one of the ways I communicate. But I'll make sure I get that information out. And if anybody's interested in going the second Wednesday is coming up to the Healthcare Commission with Dr. Weeks, please send me your information at info@marylandjusticeproject.org. If you're interested in traveling with Dr. Weeks to Town Plaza to this Healthcare Commission, send your name, information, and email, phone number to info@marylandjusticeproject.org. And I appreciate you. But as we, close this conversation out, I wanted to talk about healthcare because Dr. Sokovi down at Siege, that community engagement center on health disparities and environment, the work that he does is freaking amazing. It is amazing. And I want the listeners to understand the type of work that you guys do there when you talk about disparities and the environment. I want to share with people, they might not know that when rodents have so many diseases and God is disgusting, but their urine and their droppings causes asthma. It causes asthma. Having rodents in your community, a whole bunch of rats everywhere, man, it causes all kinds of health disparities. So I'm saying that to allow people to tie into the idea of dumping in your communities trash built up and everything that's just causing us to be unhealthy. Can you share a little bit about that work?
Yeah, so we have Siege, and Siege is a nonprofit side. That's the community-based side that goes out and works with the community. And then at the university, we have the EJ lab, which is our research side of the
Mm-hmm.
environmental health work. And what we're seeing is, and if you guys haven't noticed, our work has been under attack heavily. We've actually lost 3 grants in the past year from the federal government because they do not like us doing this research, because what we do is called the EJ screen. And the EJ screen screens all of Maryland's neighborhoods to look for air quality, water quality, safety, as Monica was talking about. Do you have increased rodents? What else is going on in your neighborhood? And we have GIS teams that map out where's your locations to the closest power plants, where are you located to grocery stores, or what does the zoning look like in your community. So it's a full scan. And but what's different from our scan from other scans that are being done in the state, ours has a racial equity lens to it, where it does has a lens where we are filtering per the what our communities look like. If our communities are heavily African American, Black, our communities are heavily Latinx or Hispanic, what does that look like for those particular communities? And so we've been exposing the differences in quality of air quality for Baltimore City and Prince George's County, particularly for water quality issues. We have some communities, people don't know this, we have some communities in this state that still struggle to have clean running water. Okay. We should not be in 2026 and we're still having groups of people who have to bring in consultants to test water, and we're having to go into the state legislators and fight for communities to get money from their local county or from the state to redo pipes and redo lines and things of that nature. So that's what it's called, the Maryland EJ screen. You can look it up and it tells you more about the data in your area. So you can put in your zip code and it can tell you about the air quality in your area. What we're trying to do and what we've been trying to keep funded is that we want to not just do a report once a year, but we want to be able to continuously test the air quality. So right now in about, I want to say about 40 different locations, just in between Baltimore and Prince George's County, we have air monitors. And those air monitors are every day are feeding in data into our servers so we can tell when there's a shift in the air quality. Right now, of course, we know there's a shift because we're going from cold weather to warm weather. So we're seeing that difference. We're seeing the pollen. We're seeing different things, but also what chemicals are being put in the air. What shift is happening? One thing we're looking at over in Turner Station in that area, we had the bridge that collapsed. So we're looking really over in that Turner Station area too. If all this construction is going to happen with the new bridge and all those chemicals, all those equipment is going to be brought in, how's that going to impact Turner Station? If you guys don't know, Turner Station is a very historically Black community in Baltimore. And it's over near where we have a lot of the docks come in, a lot of our big, trying to think, the big boats that come in with all our different products. They are an area where we've had a lot of shipment work over there. And it's been a historic area for years and years and years. We had a lot of people in the Black community that worked over there, but a lot of them also had a lot of issues with their lungs. And that was a research project started years and decades ago, looking at what the impact is on shipment over in Turner Station. You guys know Turner Station, Ms. Gloria Nelson. She is a rock star over there. And she is a true advocate for making sure that community stays healthy. So that's some of the things that we do. And we guys love to have you guys come out to every year. There's a huge symposium in September. Siege has a symposium. This year they haven't released where it's going to be at. Last year it was in Baltimore, but this should be coming out soon where it's going to be at. And we hope you guys can come because like Monica said, it's too much for me to talk about today, but we can. That symposium is a 3-day symposium that will talk to you everything about checking the filters in your house, from making sure that when you look in your pull your stove out, that all the cracks are filled in your house. I mean, there's a lot of information, good information that'll help you make sure that you are living a good quality of life.
Yeah, because I've seen stuff on in terms of environment. I've seen stuff on different shows and everything where this one family said their house was killing them. They had all kinds of leaks coming from their stove, and their child kept being sick. They had so much, they had hidden mold in their home that they didn't realize was there. And they had the most sickliest child, and it was the house that wasn't healthy. I know they have some organization called Green Homes Initiative, and I think that they do stuff where they come in your house and check the air quality and check different things and whatnot. And what Brother Robert Winslow said, that at Lowe's you can get free water testing kits. I had no idea, baby. I'm gonna get me one today. It's a beautiful day out. I'm gonna jump in my pickup truck and I'm gonna make sure that I go to Lowe's and I'm gonna get me a free water testing kit, because I don't know if you guys remember, but there was what was that place up in Detroit where they had that water, where they had that, what was that place called?
Flint, Michigan.
Flint, Michigan. And I remember that people were pressing for the lawmakers to actually be arrested because it was almost like they did it intentionally. Intentionally, they did not spend the money that was supposed to be spent to fix this issue. And people end up with sores all on their bodies from taking showers. They ended up in a bad way. And it's unfortunate again that greed will allow people to to intentionally poison your water. People are living with cancers and stuff, and they was wondering, well, how did this happen? They have places in North Carolina where these people live near waste sites, and all of them, their mother had cancer, the father had cancer, everybody in the family had cancer for years and years and years, and come to find out it was environmental, the environment that killed these people. And it is policymakers that know it. If they're going to put anything anywhere, whether it's a data center that's going to take up water and it's going to be bad for the environment, they will always choose poor communities to put that stuff in. If it's a dump site, they will always choose poor communities. Oh, Carly said her cousin lived at 1600 block of Pennsylvania Avenue and the apartment was full of mold. She says they would not move her out of that apartment. And when she finally moved out, she died a year later. That is horrific. That is horrific. They would not move her out of that apartment. She's sick, continued to get sick, 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 sick. And they would not move her until she finally moved and died a year later.
Yeah.
How
So
important she is.
I tell people this all the time. I encourage you. You have the right to have the Baltimore City Health Department. Okay, and not the health department and the housing department. You can put in a request, and they can come do an inspection of your house at any time. So if any time, let's say you're starting to feel sick, having trouble breathing, they are mandated to send an inspector out. They have to come and check. Especially if you are renting and you're a tenant and something's not being fixed, they have to come check your water. They have to come check if there's any electrical issues causing safety issues. They have to come and check and make sure your washer and dryer aren't putting out the wrong emissions. You can put in a request, and they have to come and inspect your house within a week of you putting in that request. So make sure if you're anytime somebody is saying they feel lightheaded in the house, they keep getting sick, put in that request to the housing department to have them come do an inspection, and they will tell you what has to be fixed by your landlord.
That I didn't know. I actually thought that was only for people who had vouchers. Like if you had a voucher that you can do that. I didn't know that all citizens have the right to have them coming for free because you're having an issue with your home.
Mhm.
Yeah.
Yep.
Okay. I had no idea. That's really good. That's good information. Again, if you're having an issue with your home and you feel like your house is making you sick, you feel like you have mold in there. I know I suffer from bronchitis, and when I go in certain buildings, I know if it's a high quality of dust or if it's mold in there because my breathing changes. My breathing becomes sort of like impaired, not impaired, but my breathing is different. I have a little shortness of breath when I go into spaces where there's spores of mold and stuff like that. My lungs breathing that stuff in automatically responds in that way, like it's tightening up, or like I would need a breathing treatment. Like what's that thing called? A butyrol. Like I would have to hit the pump and everything. Yeah, this has been a really good conversation, and what we got out of it, walk away with some action items. We are going to get together. Hey, sister Denise is here. Chaplain, Chaplain Denise. This is a lot of good information. So what we get out of this is that we're going to go to that. We're going to go to that healthcare commission. We're going to go there next Wednesday. Okay, we're going to find out the information. Don't forget, if you want to go to the Healthcare Commission and sit there, find out exactly what they're doing and move and groove with our sister, Dr. Weeks, just hit me up at information at marylandjusticeproject.org, information at marylandjusticeproject.org. I hope you walked away with something from today's show, and we will stay in touch with Dr. Leaks, because when you have so much going on, that's the more time you need to spend on those issues. You can't just talk about and then go to the next thing. You have to constantly go over it. It takes time. Like, we are not in this situation overnight. The situation that Baltimore finds itself in, the state and the country finds itself in, is something that's been building over time. The policies that we see now has been policies that they've been working to implement for 50, 60, 100 years. In some cases, 500 years. Since 1865, the policies that you see that are happening now is trying to take us back to those old policies, those black codes, those Jim Crow laws. Trust me when I tell you, it all leads to the ballot box and to policy and to law. And that's what we always got to focus on. That's why your vote do matter. And that's why voting do matter. And if you didn't vote, no, I ain't gonna say, I was gonna say shame on you, but it's okay. So now everybody got a chance to see that, okay, this is what we got. So let's go ahead and just try to do better. And I believe God will lead us to do better. He's going to continue to give us the information that we need, and it's up to us to get back on the right track and to take this information, actually utilize it and do something with it. Dr. Weeks, you are just so brilliant. I'm so glad that you were able to join us. Do you have anything that you want to share before we leave the air today?
I just want to share that, as you guys are thinking about it, we're going to the box in June for our primaries. As you're thinking about voting and who you're voting for, look at what their stance is on healthcare policies. Look at their stance on environmental health policies. Look at their score. All of them get scored by the League of Environmental League of Voters, Environmental Voters, Maryland League of Environmental Voters. There's certain environmental groups that they all get scored by. Look at their score. Look at their healthcare rating. Last thing I will say is we have a group called Health Means Everything. And this group is open to everybody to come and join. It's a group where we are trying to bring in more community advocates to talk about the issues that we talked about today. And so we can show up at some more of these meetings and, challenge those in place who are making these decisions. So as Monica put it out there, we have an election in June. Please research over the next 2 months what these people are doing and what they're saying about healthcare, and also join us. Like I said, when we go to these meetings, the more we have for people to come with us, the more we're able to push and put pressure to make sure everybody gets the healthcare needs they need.
Amen. And thank you, guys. Thank you, Michelle, my home girl. We was a Job Corps together. Thank you, Shantae Perry, Brother Clarence, for being here, Brother Robert Winslow, Sarah Matthews, my sister Cheryl Ward, all the way from California, up on this bad boy. I am just always grateful that God continue to allow people to come in this space that can help us get on the right track and stay on the right track. Dr. Lamb, my girl, man, she provides entrepreneurship for people, worker bee. She is truly a service-oriented person. Carly, hit me up, info at Maryland Justice Project. Carly, she gonna make sure she be there, especially with that experience that she had to have her family member live in an apartment building that they would not move her out of. They finally moved and she died a year later. It's not right. So anyway, shout out to my people. I know y'all get a lot of emails and texts and stuff from me, but I love y'all. So anyway, have a wonderful day. God bless you. We're gonna be all right.
Thank you for having me, Monica. Thank you all.
Yes, thank you. Stay on the right track. Bye.
We inspire greatness at track number 9. Stay on the right track and let your light shine. Step by step, reach for what's true. Track number 9, your greatness is waiting for you.